One of the most important things after surgery is that we want to get you up and walking as soon as we can. So we do that because it's going to improve your blood flow and also increase the speed of healing. So for patients that don't like to get up or that refuse to get up, what happens is that it increases their risk for constipation, it increases weakness, and also it can lead to things like blood clots after surgery. So even though we know that you're tired and sleepy and sore and you're hurting, we do want to get you up. So it will be a bit of a challenge, but we can do it together, and that's going to actually improve your outcomes, because research shows that patients who get up and walk after surgery, it actually shortens their recovery time and it leads to a better recovery. Okay, first let's talk about what these drains are. These are Jackson-Pratt drains, or JP drains for short. They're the most commonly used after surgery. So what they look like is it's a long tube, and at the end there's a bulb. So the tubing leads to the bulb, and the bulb, when you squeeze it, what it does is it provides a mild suction. So these tubes are stitched into your incision sites. So they're stitched in pretty well, so don't be afraid that they're going to pull out. And what it does is it's actually taking all the fluid in your incision site and draining it down into that bulb. The reason why your Jackson-Pratt drain or JP drain is in there is because we don't want fluid to collect in your surgical site. We want that fluid to come out because if the fluid were to collect, it can lead to increased pressure in that area, and it can act as a breathing ground for bacteria. So to prevent infection, we like to get all that fluid out. So what you're going to do with these JP drains is you're always going to check it every day. So you or someone can always check the site. So what you're looking for are redness and tenderness. So the area will be slightly red and it will be slightly tender. But what we want you to look for is increasing redness, or where it's so tender that if you were to even touch the site, it hurts. So you want to notify your surgeon for that. Also, you want to tell your surgeon if you start having a fever above 100.5, or if the tubing were to pull out, or if you start noticing that there's a lot of leakage out of those sites. Things to remember for your JP drains. You want to milk the tubing. So what that means is you're going to hold one end of the tubing with your hands, with your fingers, and hold it tight, and then the other one, you're just going to strip it down. So that's what we call milking. Don't be afraid that you're going to strip it so hard that you're going to pull that drain out, because the fingers that are holding the tubing should be holding it tight enough to where you can pull down and strip the drain. Also, if you start noticing that there's some clots in your drain or your bulb, that's normal. So unless the entire tubing or the entire drain, the bulb, is filled with clots, you don't have to worry. We've seen, where there's a few clots in there, and that's completely normal. It might be a little harder to empty it out when you are emptying your drain, but just, take the bulb and just keep squeezing and the clot should come out. Also, we recommend that our patients wear button-up shirts or zip shirts, because that's going to give you easier access to having your drains either pinned in the inside of your shirt or outside of your shirt, or you can actually buy a bulb belt and clip it on there. There are many exercises that we recommend after surgery. So for any surgery, exercising afterwards is great. But for breast cancer surgery, there are a few that we're going to talk about, and I'm going to focus just on two. So the first one is shoulder rolls, and that's basically what it's saying. It's just shoulder rolls. So we want you to just slowly roll your shoulders. The other one is arm exercises, arm raises. So by that, we just want you to put your arms out in front of you, and then try and raise it to the level of your ear, okay? You can either do it in front or you can move to the sides and do that, okay? So the reason why these exercises are important is because we want you to get the motion back in your arms, your shoulders, your chest. And it will hurt, your chest, your shoulders, arms, they're gonna feel tight. You might feel some tingling also because there's nerves in those areas. That's all very normal. So what you're gonna look for is, while you do these exercises, that pain, soreness should be slowly decreasing. So The main reason why we do this is because of lymphedema. So let's talk about our bodies. So the thing about our bodies is there's a system called lymph system. So that consists of lymph nodes and vessels. So typically for breast surgery, they tend to remove some of those nodes and vessels. So when they remove those lymph nodes and vessels, those nodes and vessels that carry the fluid out of our bodies in that area, since they're not there, the fluid tends to kind of get trapped, and it might be slower in emptying in that area. So because of that, that causes that swelling, and that swelling is called lymphedema. So for these exercises, we recommend that the shoulder rolls, you want to do it about 5 times every hour. Also with the arm raises, we say 5 to 10 times every hour. Now we don't want you to go crazy and do them back to back to where you're hurting. You can alternate them. It's great to have someone to join you in the exercises. We always recommend, a family member, a best friend, a partner, whoever it is, that's gonna kind of keep you motivated and do them with you. So with the arm raises, don't be scared if the first time all you can do is just a little bit. That's fine. I want you to keep trying because that's gonna promote healing in those areas. The most common mistakes patients make after breast cancer surgery is that they're not telling nurses how much pain they're in. So one of the things that I always tell my patients is to communicate, because we can only do so much for you, but we don't know what exactly you're feeling. So we want you to tell us everything and anything. We have patients that talk about, is it common that I'm burping, or is it common that I have hiccups? Those are all things that if you're worried, then we want you to talk to us. So one of the big things is that you don't tell us when you're in pain. Pain is something that we are going to both try and manage together. Don't be afraid to take pain medication. A lot of our patients are worried that they might get over-sedated or that they might get hooked being on pain medications while they're in the hospital. We as nurses are there right by your side, so we control how much pain medication you're getting along with your surgeons. There's no need to be afraid. We want to keep your pain manageable. It's not a guarantee that you won't have pain, but we want to keep it at about a 5 out of 10 level or below if we can. Make sure that you talk to us about anything and everything. If you feel you have too much gas, or if you aren't able to go to the restroom, or if it hurts getting up, just share everything and anything with us so that we can go on this journey together and make sure that you're comfortable while you're at the hospital. My name is Julianna Lee, and I am a registered nurse and co-vice president of My Breast Choice. Whatever surgical path you choose, just know that we are here to help you. Make sure you communicate with your nurses so that we can ensure that you have the best outcome possible. I wish you luck and know that we're all cheering for you.